Good morning. I'm Bryan Pope. I'm a dentist on the staff at St. Mary's Health Center in Jefferson City. My dental practice is dedicated to children and special needs adolescents. But it wasn't like that all the time, and that's what I'm here to talk to you about. About 7 years ago, I thought I was ready to ease into retirement. It was a time to relax and enjoy our 7 grandchildren. I know now God had other plans for me. Here's a lesson I've learned along the way. Don't ask for divine guidance unless you're ready for a wild ride. In late December 2003, I learned of a pending crisis in central Missouri. In January of 2004, there would be no one to take care of the dental needs of children on public assistance. You know that old standby explanation. Unresolvable contractual problems with our regional partners. The numbers were staggering: 35,000 children in a 7-county area without any access to dental care. So I began to see these kids in my practice, beginning 2 afternoons a week at first. And what an eye-opening experience it was. Little children with mouths full of decayed teeth for lack of proper nutrition and dental care. Decay leading to facial infections. They had draining abscesses, high fevers, and swollen faces. They experienced the kind of dental pain that has all but disappeared in this country for those with the means to pay for basic dental health care. Here is a recent example. 3-year-old Wesley and his 1-year-old sister and their mom were living in a motel room, one of those cheap roadside motels from back in the 50s. Their meals consisted of whatever mom picked up from the convenience store across the street. The only thing homemade that mom was cooking up was methamphetamine. After a hotline call, the kids were placed in emergency foster care, and soon Wesley was called to my attention. Admitted through our emergency department to our pediatric unit for fluids and IV antibiotics, his mouth was full of infection. After his cellulitis had been reduced and he was stabilized, I removed 8 non-restorable infected abscess teeth, a 3-year-old. Now this is where the "together we can make a difference" part comes in. I would not have been able to treat that little boy and hundreds like him without lots of help. After agreeing to see these children, I soon realized their complex problems demanded more than the treatment that we can deliver in an office setting. We needed the health center's operating rooms and the skills of their anesthesia providers. St. Mary's stepped up and dedicated an OR block and acquired the necessary equipment. Today, the hospital's anesthesia group, Mid-Missouri Anesthesia Consultants, along with St. Mary's Pediatrics, provide the medical backup and the anesthesia services that a dentist so desperately needs to definitively treat sick kids with dental disease. Since this team was assembled in December of 2004, the health center has made it possible for me to treat over 1,000 children in its ORs, 1,010 to be exact. The difference this has made in the lives of those 1,000 kiddos, well, it's indescribable. Today, we are a team always prepared to say yes to a suffering child and to definitively treat their dental disease. From our emergency department, our pediatric unit, outpatient services, OR, and recovery units, to all the hospital, to our CEO, Brent, we all know that a care note, a discharge summary, doesn't end with instructed parent to take child to a dentist. No, we are the provider of last resort. And in our community, in our region, you will hear people say, My God, get that kid to St. Mary's. They can really help. With one voice together, we do make a difference, the difference, especially for the many children in poverty who have no voice at all in this world. A good ending is contemplating not seeing another 3-year-old suffering from a raging dental infection. Till that time comes, let's just keep at it. Thank you, sisters, and all my teammates from Jefferson City that are here and back home for giving me this opportunity to continue serving and keeping at it. Thank you.